Tēnā koutou katoa, ko Maria Ramsey, taku ingoa, he toi hautu, tēnei nā te Toi Foundation me te Toi Foundation Holdings Limited. So I'm Maria Ramsey, I think I know most of you. I'm the Chief Executive of the Toi Foundation and Toi Foundation Holdings Limited. Before we kick off, I'll just open up with a karakia. Kia uru uru mai, ahau ora, ahau kaha, ahau maia, ki runga, ki raro, ki roto, ki waho, te ririri hau, pau Māori. Right. So I'm pretty sure most of you know that we own the TSB Bank, but a lot of people still don't know that we have a controlling share in Fisher Funds, and that's been a real game changer for the foundation. So we get, through Toi Foundation Holdings Limited, we get around about 40 million in dividends from Fisher Funds and around 10 million from the bank. This has seen our contribution over the last 5 years pretty much double, more than double, so that's great for our community. This year alone, we're about to wrap up our financial year at the end of March, and we'll have given out around about 24 million to our community, which is a great effort. And so I guess, this is the chance for a plug. So if you bank with TSB, or you have your KiwiSaver or investments with Fisher Funds, you're supporting our community. So when you're looking to apply to the foundation, we basically have 4 buckets of money. We have our Strengthening Communities Fund, which is our traditional philanthropic funding. Then we have an Innovation Fund, which we look at both seed and scale funding for new initiatives. We have Strategic Fund, and that's where we look at supporting organisations for multiple years so that they've got some surety of funding. And that is also where we're a lot more focused. Then we have our Impact Investing Fund, which is very new for us, and that's where we look to recycle our capital through either loans or could be equity shares. So the Foundation's purpose is to support our community to be a thriving, inclusive and equitable one. We have 4 short-term outcomes that we believe will help us to meet that outcome, that purpose statement, and they are improved environment, access to opportunities, rangatiratanga, empowering Māori aspirations, enhanced child and youth wellbeing, and for the last 18 months, 2 years, we've prioritised rangatiratanga and child and youth wellbeing. And in this coming financial year, we'll be looking to develop an improved environment strategy as well. So, you've been invited here today to better understand our region's economic and social disparities. So the Toi Foundation commissioned this piece of research with Infometrics to help inform our future funding so that we can ensure that we're funding where there's the greatest need for our community. There's a few areas that have shown up that we would really like to focus on as an organisation, and that's part of what we'll be looking to do in our strategic and innovation funding. We've undertaken this research so that we've got a clear evidence-based component to go back to when looking at where to make those investments. And I'll now introduce Brad, who is the author of our report, who will take you through some of the key findings.
Kia ora and good morning, everyone. It is wonderful to be here. My name is Brad Olsen. I'm a Principal Economist and Director at Infometrics. We are one of New Zealand's leading regional data providers, as well as our other general economics roles. And I guess when we looked at this project, the feeling here was to do something relatively innovative and something that when we were talking to the team at the Toi Foundation was not something we'd sort of embarked on before, and that was to not only have a bit of a review of what information we knew about the region, but to pull it together on a comprehensive basis, and importantly then also use it or have, in this case, Toi Foundation use it to actually inform strategy. A lot of the time we'd write a tome for a client and it would sit there and never really be used, but also would sort of just be a bit of a standing snapshot of one part of the economy. It might be, employment, it might be skills, it might be education, but we wanted to do that on a relatively comprehensive basis this time. And so for the next, strap yourselves in, hour or so, I will take you through the findings. They are quite detailed, but that is because we did want to get as holistic a picture of what's happening here as possible, because without that connection between all the different parts of the research, you don't really get the feeling of not only what challenges and needs there are in the community, but also, in a sense, how to address them. So then, if we look at sort of how we approach some of this research, and so again, this is not trying to, if you will, identify every problem that Taranaki has. That's something very easy for reports to do, and certainly might well show up a little bit in this research. It's certainly not designed, though, to be a pick on the region report. It is supposed to be identifying some of those challenges, and the point being what gets measured gets managed, and it's only once you have that information that you really can start to make some of those decisions. Now, a lot of you here in this room are going to be a lot more knowledgeable about the actual outcomes on the ground than I am, so I'm certainly not going to confess to wanting to get into all of the nitty-gritty. And a lot of the findings as well might well be known to you or your organisation. What's probably not quite as clear is if that information is clear to everyone else. So by having that sort of common understanding, that common foundation of evidence, the feeling is that you can drive not only better outcomes but greater collaboration to try and use this information in a much more constructive way. So how do we start? Because in a sense these sort of projects can turn into something bigger than Ben-Hur. We used our regional wellbeing framework to start with. Infometrics developed this back in 2019. Now it's based on the OECD's Better Life Index, which is sort of the wellbeing framework of the world, if you will, and also the Treasury Living Standards framework to try and have as much alignment to what government uses as possible. Now, the challenge with both of those two international and national level wellbeing frameworks is that they are based very much around a lot of surveys and similar. Now, surveys are great, but any statistician will tell you that surveys at a local level have to survey a lot of people to be particularly significant. So instead of using lots of surveys of very small populations that wouldn't necessarily make as much of a difference, we used a combination of our own proprietary analysis, but also administrative data from just about anywhere we could reach. But the focus here was as much as possible trying to be on either wellbeing outcomes or things that would stem through to wellbeing outcomes. A lot of the time we measure inputs, if you will, how many meetings or how many consultations has there been. Now that's fine. I could do a project and have 50 meetings with you guys a year. We could come up with absolutely nothing, but we'd still meet our KPI. So instead of that sort of input or even output point of view, we tried as much as possible to come from an outcomes point of view so that we understood what was happening a bit more. It won't capture everything, simply because sometimes we don't measure as much as we should, but it does give us some very strong lines of inquiry as to where to head to next. And like I said, I do just want to reinforce that sort of innovative use. We've done a fair bit of this sort of analysis. Never before have we pulled something, one, so comprehensive together, but two, to be used in such a definitive way. And I think that's a real credit to why you guys are all in this room, to try and contribute to improving those outcomes and creating that thriving Taranaki that everyone aspires to. So what I'm going to do is twofold. I'm not going to actually take you through an executive summary and say these are what we found to start with, only because the purpose of this research wasn't to come in with a few predetermined views. It was very much to look at all the evidence and then frame up something from all of those cross connections. So I'll take you through the evidence first, which will be the bulk of it, and then we'll draw those connections towards the end. Hold your questions, if you will, as we go through. We'll get towards them in the Q&A section, only because one, it'll break up the flow a little bit and we could get sidetracked, but two, I might well try and answer your question a few slides later. There is a bit of a knack in that. And then, like I said, we'll build into those sort of broader trends. So, first and foremost, we looked at some of the different domains that we've got of wellbeing as we generally define them. And the first one there was civic engagement and governance. And the first metric that we looked at was just a bit of a feeling of, look, how connected do people seem to be in their local community? Not the only metric, and possibly not the best metric, but one that we very much can measure, is how many people vote in the general election. Just to give a bit of a feel of, look, if you're not even voting for who your MP is or similar, just how connected do you feel like you are to that broader decision-making process? It's pretty low touch. You fill it out every 3 years. Literally, you can go and tick a box if you want. It's not sort of huge barriers to entry. What you can see and what's reassuring there is that the numbers have continued to increase year on year across all three parts of the Taranaki region. So encouraging that you do have a very strong starting point when it comes to people's engagement, both locally but also across the country. These numbers are a very small touch lower than the national average, but that's very much in line as well with what we see from a number of provincial regions. I think it's probably more important because we really are talking at the margins between the national and the regional regional results, the fact that upwards trend is coming through is a strong starting position. We also saw a considerably high level of volunteering happening across the region. Now, to be fair, you look at that and you go 16.5 volunteering in the region versus, just over 15% nationally. Doesn't sound like a huge amount, but this is people who have already got a lot of stuff on their plates that are still spending time out there in the community. Now, when we say volunteering, this is very much, the classic volunteering that you would all think about. It is out and about in the community. It's not necessarily helping around at home or similar, as much as I'd like to say it. My mother didn't think that was volunteering when I did the dishes. So this is really, getting quite deeply connected as much as possible. And so the fact you have a greater level there, again, demonstrates people are willing to get out and about, they're willing to contribute back. Strong foundations, again, in terms of that engagement. What was also, I guess, surprising, given that we have seen, and you'll see through this research, quite a number of more challenging statistics for the likes of South Taranaki, the fact that the region had the highest volunteering rate again suggested that although there are some real challenges and needs in the South Taranaki population, the community there is more than willing to give it their all to try and change things about, and it does, I guess, suggest that collaboration and similar will help drive better results. One of the unusual findings, and this is very much, if you will, an open question, if anyone's got an answer, come and talk to us afterwards and we'll clear it up, but was this finding as well that when we looked at those volunteering numbers, some of the other statistics within that data set looks at how many people might be caring for children, either within their own home or someone else's, and we did see a higher than average level of that coming through. Now again, you look at those numbers and you look at the first bullet point in the second group there, looking after children who are not in your own household, 17.4 versus 14%. Now again, 3 percentage points, not huge, but the fact it was the second highest in New Zealand, and it doesn't immediately spring to mind why there would be a larger proportion of people in Taranaki that have to look after a child who's not in their own home. It again just suggested that there is something more in there. Now, I'm not necessarily saying that Taranaki needs to go and build thousands more early childhood centres and similar, but it was worthwhile profiling that when we did look into those numbers, it was a question, and that's very much a question for the moment over what that looks like. But it was, it certainly came through when we looked at the numbers. That was one of the more striking differences, if you will, in some of the analysis. If we look then at healthcare, and this is sort of definitely where we get to some of the more foundational elements, of course, when we look at the likes of civic engagement and governance and what have you, that's important for local communities, and we know that there's a substantial amount of effort that has to be put in, but we also know if you don't get the foundations of people's lives right, it's very difficult to find time to volunteer, it's very difficult to find the energy to go out and about. And so the likes of housing and health really do get to some of those greater levels of need. And again, we see some interesting numbers coming through there. When we look at life expectancy, which is sort of your catch-all for the health of the population, how long are people expected to live if they are born and grow up in the local area, slightly lower than the national average when we look at life expectancy there by about 0.7 of a year going forward. Now, to be fair, those numbers are always pretty small. What was interesting is when we tried to break that down into different groups within Taranaki, we did see that there was a lower life expectancy for Māori versus the Taranaki average. Not surprising when we look at most of our health statistics show that Māori have a lower life expectancy. What was, I guess, encouraging, though, was also that Māori had a higher life expectancy in Taranaki than what they saw across the entire country. So the gap, if you will, between total and Māori life expectancy nationally is a much larger gap and shows greater inequality, if you will. In Taranaki, yes, there is definitely still a gap, but it's better in a sense than what you see on a national level. So again, suggests that there are some strong starting foundations from where we move forward there around addressing some of those health inequalities and similar. One of the real challenges, and this is something that we have known for a long time, but again, very hard to prove or make the clear numbers on, is the mental health burden on a local community. Now, we took what we're thinking is a relatively innovative approach, because everyone asks about this, and often we measure the likes of suicide numbers, which is very much an important number, but also really only scratches the surface of mental health burden. We know that suicide is one part of a very long and challenging continuum for a number of people. And so what we looked at as a bit of a proxy was how many people in the population fronted up to a mental health service, if you will, presented in the terminology for mental health support. Now, you could well, just thinking through it, you could well have that higher proportions of people could relate to greater access because people feel that they can find more services. We have cross-checked these numbers with reports from people over their own self-rated mental health, and we know that people are feeling that their mental health is worse now than it was previously, so the upwards tick in our minds because of that suggests a greater mental health burden rather than necessarily better access. We'll get into the access in a second. What you can see here is that for basically everyone, both nationally but also within the region, that there has been a steadily increasing number of people that have been going and accessing mental health services as that mental health burden grows. Wouldn't take too much stock in a sense of the slight dip you see towards the end of the series. Part of that is COVID, where people weren't able to go to services quite as much, but the general trend there you can see is relatively strong. Now, if you look at New Zealand there in the purple, you can see that the New Zealand rate is broadly speaking considerably lower than most rates across the Taranaki region, and that in fact you can see that likes of New Plymouth there coming out with a considerably higher level. So over time we have seen that people across the Taranaki region have been reporting effectively a higher level of mental health burden and have been accessing services to try and address that. So again, suggests there's some underlying challenges and issues there when it comes to mental health, and again with some of the other analysis does help to contribute towards where we might think we need to go next. One of the more reassuring numbers is a falling rate of smoking in the community. Again, not necessarily as important for everyone's well-being, although certainly important that I don't have to, suck it in walking along the street and have it in my lungs as well. What we do see there is that better outcome across Taranaki, falling from 22% back in 2006 down to 16 in the latest numbers we've got available. Now that is ever so slightly higher than what you've seen across the country, but again, the direction does show that there are improvements that have been coming through. What's interesting is that every now and then for some of these data sets, and it's not all the time, which is why I haven't shown you too many so far, we do have slightly more detailed insights. We can zoom in to a much greater level of analysis around sort of a more suburb or community settlement sort of level. And based on that, we have seen that there are, again, some hotspots, some areas of greater need when it comes to addressing health challenges. You can see that some of those areas you can have above a 27% rate of smoking in them still. Now, remembering that back in 2006 it was in the low 20s across the region, so the fact that you've still got these areas in parts of New Plymouth, Stratford and South Taranaki with high rates, again, just suggests that there are some greater needs in those communities around access to the likes of smoking prevention and smoking support, but more holistically goes into that wider challenge around healthcare access in some of those local areas. Now the big one, and this is one that you probably will never have seen before because we got this data only in sort of recent times, and it's still a bit of a struggle to get through, to the point when I presented some of this early analysis through to the Toi board and management. This was the hot topic question that I frustratingly couldn't answer, so let me take you through it. This is what we call ambulatory sensitive hospitalisations, or otherwise known as avoidable hospitalisations. Now you'll all ask what's in there, and basically trying to make this as simple as possible without going through every ICD-10 code. It's the likes of healthcare requirements where someone has attended hospital where, broadly speaking, if it had been picked up earlier through primary health or something else, they shouldn't have needed to go to hospital for that condition. There should have been some way, shape or form to pick it up and support them without having to go sort of to the emergency department. And you can see here, when we looked at it, that there's a considerably higher rate of avoidable hospitalisations in Taranaki than in the rest of the country. And again, a variable set across the three local council areas with a much greater prevalence in South Taranaki. Now, I can't fully explain to you why exactly that is the case, but I guess building with some of the other numbers that we have around that mental health loading and similar, but also as we go through some of the other analysis around housing and income and what have you, will start to contribute and suggest through why we might be seeing some of that. One of the findings we did find, I'm sort of letting the cat out of the bag a little bit here, when we looked at a few various measures, was around the likes of access to healthcare, which is coming up in a slide or two. when we looked at that access to healthcare, and we looked at sort of, how are people in Taranaki utilising healthcare services, what we saw, broadly speaking, is three things. One, that people in Taranaki don't visit the GP quite as much as the national population. So people aren't going to their primary physician. Obviously, that if you sort of extend that thinking out, it's that either for whatever reason they're not accessing healthcare early enough, and that seems to be leading to greater challenges further on down the line when things get worse. You can see there's a much greater level of people in Taranaki who are presenting to the emergency department, again backing up that level of avoidable hospitalisation and backing up that feeling of sort of, if you were waiting too long or somehow not being able to access healthcare in the first instance, and things getting worse before they get better and leading to some poorer outcomes. And then lastly, not only do people visit less, but when they go a much lower number of times each year to their primary healthcare provider. So again, starts to provide us a bit more of that information, that holistic view of, okay, we've got some poor health outcomes, do we just need to build another hospital? Well, maybe not, although that would probably definitely support the high level of EDs. Just as equally, I don't think it would necessarily be that we all of a sudden need to be paying for people to shuttle to the likes of primary healthcare providers and similar. Because when we looked at, for Taranaki and the rest of the country, around why people couldn't access services, things became a little bit clearer by what wasn't in the graphs rather than what was. Now, if you look across this, you'll see that Taranaki has a fairly standard profile going top to bottom in terms of unmet need for prescriptions because of cost. So there's sort of nothing necessarily all that different here in Taranaki than the rest of the country. Sure, there's issues there, but broadly speaking, there's nothing unusual in this part of the world. We look at the rest of them and you'll see that there is a slightly higher, very slightly higher level of unmet need for after-hours use because of cost. But to be fair, those little bars there show the error margin. It's sort of within that sort of error range. Unmet need for going to the GP because of transport, well, that doesn't seem to be a huge issue here either in terms of actually being able to get somewhere. Unmet need because of cost, also not showing up really all that much given the error margins on the data. However, this is where you start to get into it a bit more. The unmet need of actually being able to find an appointment for your GP within 24 hours is much larger in Taranaki, even with the error bars. And the like for unmet need for primary health. So what all of this is essentially saying, the too long don't read, is that people in Taranaki are not able to get to their primary healthcare doctor. And it's not because of cost and it's not because of transport. And it would imply, using the other metrics that we've got, that the challenge there is actually finding a healthcare provider to go to. Now, we did a bit more of a dig into this because this was sort of quite a major revelation, if you will. And what we did find is that Taranaki has a lower proportion of doctors and medical staff generally relative to the population than other parts of the country on average. And so it does suggest that if you're in a part of Taranaki where you are struggling to find healthcare, it's not because you can't drive there, it's not because you don't have the money to go there, it's because when you call up, there's no one available right this second. And it does again suggest a different way of starting to think about delivering healthcare potentially in Taranaki, and where some of that more community support might be needed to enable that to go forward. So, moving on from health into the housing area, and certainly the perennial topic that New Zealand likes to talk about, depending on whether you've got a house or not. And going through some of that, we do see that there's actually a relatively healthy level of home ownership in Taranaki. In fact, slightly above the national average, 69% in the region, 68% nationally when we look at those average figures. Importantly, fifth highest in New Zealand, so again, not ringing any alarm bells there, generally speaking. And also, in a sense, you see that the distributions across for the likes of Stratford and New Plymouth, relatively broadly in line, over 70%. Massive drop down, though, when we come to South Taranaki. And we'll explore that in a little bit as we move forward. But again, I guess you're probably starting to see now that we've seen a few statistics so far that suggest that although in broad strokes the likes of New Plymouth and Stratford are in a similar sort of vein when it comes to their outcomes, South Taranaki does seem to be lagging on a few of those statistics. And again, just to highlight, there are some more common areas that come up when it comes to, those figures there, this is where I got my slides wrong. Those figures there at the bottom are the same repeats from my smoking slide because I copied and pasted half of it and didn't get rid of the second part. Apologies for that one. So we know that's across the entire region for housing, and we know what that looks like for the likes of South Taranaki. But when we dive into it a bit more, we look and we see that particularly young people, and particularly Māori, have worse outcomes. Now, when we look at, and this gets a little bit technical, but I just want it because there are lots of confusing numbers flying around. When we look at the types of people that own housing, we have to cut things a slightly different way, because to look at the likes of home ownership for young people means that we can't look at it, or Māori, for example, we can't look at it on the same basis as that 69-68% figure I showed you before, because you'll often have multiple people in a household. So we look at what we call individual home ownership. Individual home ownership tells us that nationally you've got around about 52% of the population of people that own their own homes. Which is different from the 69% of people that live in a home that is owned by them or the person that's there. So, for example, when I lived at home, I lived in a household owner-occupied dwelling because mum and dad owned it. A little bit young to be owning it myself at that point, but so that's where the 69 comes from. Looking at everyone in this room and saying, hands up if you actually physically own a house, that would get us to the 52% number. So, when we looked at that, we saw that for Māori and Taranaki there was a considerably lower level than the national and the regional average. And so you're talking only sort of just over 34% of Māori across the areas owned their own home, and again just suggested that there were some big differences in play there. Now, we know that young people generally don't own their own home quite as much, and that makes sense, right? You know, young people don't magically have all this money at age 18 and go and buy a house. So we're not awfully concerned at more young people generally not owning their own home. What does become more concerning is when we look at the 30 to 64 age groups, so more that sort of prime. You've had 12 years or so, generally speaking, outside of school to start amassing some money. That's generally where we'd start to think that people will be buying their own homes more. That's actually where the largest gap between the total for Taranaki and the Māori population for Taranaki emerges. And it does suggest that effectively Māori, for various reasons, haven't been able to pull together that deposit or similarly get into housing in general. And again, just helps us understand that profile of where are there likely to be issues. Because this research doesn't suggest that we all of a sudden need to be going and buying every young person in Taranaki a house. That sort of thing there is sort of a natural progression, but there is now an identified challenge around Māori sort of in that sort of middle age group who are struggling to get into their own housing, and that of course has implications for their own ability to pull together wealth, their own sort of actual housing and health outcomes, and similar across there. So we wanted to try and provide a bit of a split out of those figures. Part of the reason we know there are housing challenges is because it's more expensive to rent. And now if we look at these figures here, you'll see they're not sort of getting awfully concerning by absolutely skyrocketing, but the fact that you continue to see over time a greater proportion of people that are paying more of their money towards rentals and their renting costs does suggest, again, it's going to be more difficult for those groups to be saving as much, to potentially save up for a home deposit or similar, because every week, you know, yes, their income might have gone up, but their rent has moved ahead of their income, and so therefore they're having to put more cash on the rental. At the same time, that's less money that goes into the savings account each week, and so that distance, if you will, is that for every step forward that you take with your wage, you take one step back with how much rent you're paying out, and how much, and 12 steps forward, the house moves away from you because of that sort of gap in savings and house prices and similar. What's also interesting though is that you'll see there that South Taranaki in the green has a considerably lower level of just how much income goes on rents than most of the other parts. So again, sort of a little bit confounding considering some of the other measures that we've got when it comes to income and housing outcomes for those in South Taranaki. But I think what that suggests there is a bit of an averaging effect, where we're looking at average income and average rents, where there are going to be some people that really do struggle. And one of the other metrics that we've provided, and that I'll touch on a second, looks at social housing, which is a bit of a better metric. But just to clear out those sort of income, housing to income metrics, if we also look at the likes of our price to income ratio, so how many annual incomes a year a household would need to save up to buy an average house. Again, you can see that in Taranaki things are all right on a relative sense compared to the national average, definitely creeping up in recent times, but certainly you don't get the feeling that broad affordability is as much of a problem in Taranaki as across the entire country. Now, I'm not saying that those levels are good, I'm just saying on a relative sense there is certainly a feeling that there are better outcomes here. What it also suggests though is when we look at some of those groups around the likes of Māori and younger people who are looking to buy houses. The fact that on this metric that houses are more affordable also suggests that, again, the barriers to getting into housing are something that need to be looked at around the access to deposits and what have you. Now, the other one we looked at, and there are, again, quite a few bits and pieces that we pulled together here. Now, all of those metrics are, again, like I said in the rental slide, very averaged. They look at the total average income for the entire area and the total rental income for the total area and divide the two. We wanted to have a bit of a look, though, at the more distributional effects and have a look at also the number of people that are on either in public housing or waiting for public housing. Now, these numbers here from MSD show quite a considerable rise. What I guess I would focus on is that this has been across the region. It has been in all parts. More challenging is that, and one of the numbers that is very hard to represent on a graph, which is why I'm speaking it to you rather than showing you a chart, is that when we looked at the number of social housing spaces in each area relative to how many people are demanding them, South Taranaki, though, came out as a real concerning area. There are more people on the waiting list in South Taranaki for social housing than there are the total number of social houses currently in deployment. And what that intuitively says to us is that there's been a much larger extension in the needs for those who need social housing in South Taranaki that social housing generally just hasn't been able to respond to quite as quickly. And again, suggests that on a distributional level there's a need to provide greater support for those into social housing, but also look at new ways of delivering those sort of models, because basically you do have the challenge now where there are a considerable number of people in Taranaki, of households here, who are struggling to put a roof over their head, and it's not as easy to be seen in the likes of our rental and household affordability metrics, but it is seen here in that very sharp rise in need. And we also know that some of the households that people do have aren't of the best quality. When we looked at, and this is relatively new data, we've never had this before, but looking at the number of houses that are damp or mouldy in the area, in general, and a little bit of a weird one, mouldy houses broadly in line with the national average. Damp houses, though, are certainly of slightly more concern. And again, very small proportions here, but you've got 18% odd of the Taranaki housing stock that is sometimes or always damp, relative to about 17% nationally. Now, 1 percentage point doesn't, again, sound like a lot, but what it does suggest is that, again, there's something different here in Taranaki. Also, more importantly, the fact that any houses are sometimes or always damp should, in my mind, be a concern, because that's not a particularly healthy home. What we also saw was that parts of Stratford and South Taranaki generally had damper housing, and that there were some of the usual areas, if you will, those sort of smaller communities that we've already identified a few times in this presentation that keep coming forward with greater needs. And again, suggests for some of those local communities a greater need to have more holistic support, rather than going in with bags of insulation and lots of heat pumps. There's sort of a greater need to go, okay, if there's a few pockets of challenges that keep cropping up in these areas, what is that more holistic support, community-led support that needs to come forward? So, I haven't started boring anyone out too much yet, but we will continue to crack on. If we look at the likes of income and consumption and some of the likes of jobs, earnings, the sort of more economic and stuff that economists are certainly more versed in, we'll see, look, just starting off with median household incomes, we don't have as high a median household income across the Taranaki region as the rest of the country. So just a starting point that you've got less cash than most other parts of New Zealand when it comes to living in Taranaki. Those numbers, of course, generally skewed by the likes of our larger metropolitan areas, which have higher qualified workforces, and importantly, in areas with higher qualified workforces, also a lower proportion of lower qualified workforces. So Wellington, for example, has a very high household income average because it has lots of high-skilled people and not as many of the low-skilled, whereas Auckland, for example, a bit more middle of the road because they have lots of high-skilled but also lots of lower-skilled, lower-paid people to average it out. Just an important reference point in terms of how much cash we're talking about people might have. What is interesting, though, is that the distribution is quite different, and again, not something that we look at quite as much, and we probably should a lot more. broadly speaking, we've broken this up into income bands, so people that earn below $20,000 a year, 20 to 30, yada, yada, yada. What you will see is that Taranaki generally has a much higher proportion of people earning in those lower bands to start with, and as you get towards the end, a much smaller proportion of people earning in the higher bands. So that does say that income in Taranaki skews lower, and again suggests there's a need to, where people are looking to have to buy goods and services across the economy, generally speaking there are going to be a larger proportion that don't have quite as much, although the averages will still sort of skew around that normal that I showed you in the prior slide. But there are issues here around distribution, there are issues here around equality and access and similar, which is another sort of prong that the foundation looks to address. And you can see that relative to New Zealand, where it has a much lower starting point, but very much goes through into that higher position over time. So a real divergence there that you do see across the Taranaki region relative to the national average. When we looked at the deprivation scores, now this would take us probably an entire year to go through and make sure everyone was on the same page here, so I won't labour the point too much. When we did look though at the New Zealand Deprivation Index, which is produced by the University of Otago, takes into account quite a broad range of things around access to food and amenities and bits and pieces. You did find that there was a slightly higher average deprivation here in Taranaki, about a percentage point higher than the national average. So again, just confirming that feeling that there are some challenges broadly in the community that need to be addressed around those distributional issues, where there are some that are doing fine in Taranaki, but a larger set that are still struggling a bit more. Reassuringly, in the sense of it confirms all of our other thinking, is that we did see the greatest levels of deprivation coming through from South Taranaki, then Stratford, and then New Plymouth, partially because of that more urban style of New Plymouth as well, and the greater sort of spread that the likes of South Taranaki has. We know there's a high level of benefit need across the local community as well, and you'll see that when we look at the number of people on a benefit as a proportion of the working age population, the New Zealand average continues to trend down broadly, up a little bit in more COVID times, but you'll sort of see that the Taranaki trends in recent years over the last 5 or so have been on a bit more of an upwards path, so again suggesting that we have not only those income distributional issues, but that more people are having to rely on government funding to support their lives and livelihoods. And again suggests that difficulty of actually sort of being able to make your own choices as a family and a household and have that greater sort of livelihood and outcome. Part of that is very much being shown by a high level of Māori in the community on a benefit. If we look at these figures, you can see there that relative to the population, there's a much higher and a persistent share of Māori who are on a benefit across Taranaki. To be fair, it's across New Zealand as well, but it does again establish and underscore that difference that we're seeing for Taranaki's Māori community as opposed to just the general population, and also starts to help us recognise again where that support might be well needed. Especially when we look at age groups, and we can see that there is a sort of a broad smattering of age groups, but importantly that all age groups across the South Taranaki area continue to show that higher level of benefit need. And if I flick back to the last slide for a second, you'll also see a considerably higher level of Māori need in South Taranaki. So I guess the point here is that things are not quite as much cut across our sort of ethnic lines and our sort of and our age demographics, because both are high. What we do see in both of them is again that sort of greater need, if you will, across the likes of South Taranaki, which establishes in my mind a greater need to focus on the locality rather than any of the other definers quite as immediately. And part of that is also, I guess, highlighted with the persistently higher unemployment rate you see across Taranaki, even as the purple line there for New Zealand continues to trend down over time. Yes, unemployment is quite bouncy, but you do see it stay up in that higher position. The same thing is reiterated with NEET rates. Now, I haven't charted them because honestly it's the most ugly chart you'll ever see in your life, but the feeling there is that although it's highly volatile, it is again a persistently higher NEET rate. Young people not in education employment or training in Taranaki than the rest of the country. So again suggests that challenge around the likes of education, around employment, but also the health and housing foundational settings. That if you get those right, people feel a lot more comfortable in their lives. If you don't get those right, if I haven't had a good night's sleep and haven't had a nice roof over my head, I'm not keen to go to work, I'm not able to sort of do quite as much. And so it sort of establishes some of those figures as well. Finally, moving towards the end, because I know that one, we're coming up to time, and two, you're all like, man, this guy's been talking for a while. But bear with, because I do hope you're starting to get a bit of that feeling of how this is all coming together. When we look at the likes of knowledge and skills, now importantly we know that a lot of young people across the region go to early childhood before they go into school. A great starting point for young people and tamariki across the Taranaki region. In fact, slightly higher than the national average by 0.2 percentage points. Now, to be fair, the feeling is that most people go to early childhood. I mean, you get 20 hours free at a certain age in New Zealand anyway. So there's already a very high bar, if you will. So it is, although quite concerning in a sense, you look again at South Taranaki coming there with a much lower rate, just below 95%. Now 95% doesn't sound awful, but when the national average is 97 and South Taranaki shows up as the 11th lowest out of 66 local council areas, again just suggests there's something different going on there that does require that greater support, because we know that if young people don't go into early childhood, they generally don't have quite as good educational outcomes coming out of school, and again there's a challenge there around their employment ability and their ability to determine their own lives and move forward over time. Reassuring to see that a high number of people across the region do come out of school with NCA level 2, sort of the basic benchmark, if you will, when it comes to educational outcomes. Interestingly, given all of the things we've talked about, Stratford coming in with a considerably lower level of people that are exiting education with NCA level 2. So again, the research throwing up some unusual patterns, if you will, and certainly ones to look into and be addressed sounds a bit too drastic, but certainly understand what might be driving those educational outcomes more. Again, knowing that if we don't get those better educational outcomes, it's harder for people to sort of make greater progress in life, to be able to sort of earn the sort of money they might want to look after their families, to give them those choices and opportunities that they might strive towards. But generally you'll see a fairly consistent number there, and that's certainly reassuring. Always room for improvement, especially as you have seen in recent years a bit more of a plateauing in some of those general numbers around that sort of 80% mark, and there's certainly a feeling that that's still 1 in 5 kids that is exiting without at least NCA level 2. Where do they go to from there? Well, around about 60% of people in Taranaki continue on from school into some sort of further education. Doesn't need to be university, it can well be polytech, on-the-job training and similar, but something a little bit further, which we know is a key definer of the sort of progress that you have for young people. Not saying people shouldn't go straight into the workforce, but we generally see that level of upskilling going on. Now, what's I guess reassuring there is that you've got in the broad numbers show that numbers here in Taranaki broadly in line with the national average. Again, a much lower proportion though, less than half in South Taranaki going on to further education. Just again compounding that, the challenges and the needs focus that we've established and that requirement of greater intervention. Part of that, and it's sort of just to try and give you a bit more of a local view, if we look at enrolments and completions and similar, excluding the last year, which again was a bit more COVID affected, you do find that sort of more gradual decline in the number of people completing courses, at least relative to the number of people that are enrolled. You'll see that those enrolments sort of not dropping quite as much, but completions certainly sitting a touch lower, and again just suggests a real need to continue that focus of how to provide education locally, the review of vocational education that's ongoing, but also the role that the regional skills leadership groups will provide both here in Taranaki but also across the country will be important to try and join things up a bit more so it's not quite as haphazard as it has previously been, allowing for that greater level of integration. We are getting towards the end, promise. We get towards safety, and just a sort of a brief note, because this is, of course, an important sort of general definer of wellbeing outcomes for lots of people. Thankfully, we don't necessarily all experience crime in our daily lives, but it does give us a perception around what the local community does experience. You can see here that, generally speaking, the rate of crime in Taranaki has been and sort of sits persistently higher than the national average. Now, we haven't quality adjusted this, so we haven't sort of said, it could well be that there's lots more smaller end crime rather than sort of the big nitty-gritty that Auckland might see with lots of firearms. But generally speaking, the feeling when we look at these numbers is that there's still that persistent level of higher crime, which just, again, leads into that feeling of, well, if we can address some of these other more foundational societal and economic issues, perhaps we can start to drag down that crime rate as well, because people, have different opportunities and not necessarily having to look into criminal activities and similar. And very lastly, when we look at the likes of social connections, and this is one of the big ones, is the sort of connections and ability to interact that people have. We can see that in Taranaki there has been an improvement in digital access between censuses between 2013 and 2018, but at the same time, digital connectivity across the region remains lower than the national average. So again, in this increasingly technologically focused world, when the government and most businesses are starting to move online, we're seeing banks, that are changing the way they operate. We're seeing, government agencies doing the same. Job interviews now happening via video than in person a lot more. All of that suggests that if you're one of those 18 or so % of households that can't currently access internet, you are going to struggle in this more digitally enabled world. And so again, just suggests that we've got some inequitable outcomes coming forward. Again, a much lower rate for South Taranaki than the rest. There is also a higher rate of transient students moving through in different parts of the region. When we looked at the truancy rate, we saw that actually Taranaki's broad truancy rate is slightly lower than the national average, which is again supportive, but the truancy rate for South Taranaki is considerably higher, and part of it is very much because of this. There is a greater number of transient students, so students who have to move around quite a lot and switch their schools much more regularly in South Taranaki than other parts. And again, with all the other evidence we've brought forward, does suggest that in South Taranaki people don't have the same ability to access healthcare, they don't have the same ability to access housing, they move around a lot more on these metrics, and therefore people are not getting quite as well established in their communities and their schools and similar. And important to connectivity as well, we found that about 92% of the region has a driver's licence. Pretty good number, very much in line with that national average, in fact slightly above. Very high rates in the likes of New Plymouth and Stratford, but again, South Taranaki, you've got over 10% of the population there who don't have a driver's licence, who could, of those aged 15 plus. And so again suggests that for people in South Taranaki, you find it harder to get the internet, and you also probably find it harder to get around relative to other parts of the region. Looking at the environment very, very briefly, we see that there's a slightly lower level of waste diverted, just a bit of an idea of sort of our resource loading in the community, that when we look at just how much stuff gets sent to landfill or doesn't, there is more work to be done here in Taranaki. New Plymouth, of course, having a better number there, sort of arising from the more urban focus, but then if we look at the likes of South Taranaki and Stratford, slightly lower, and I'm sure councils are generally looking at that. There is a much greater strategy nationally around that sort of waste diversion, and we're trying to pull better numbers on it as well. The very final one for the environment, just briefly on emissions, very high emissions in the region, the second highest behind Southland. Part of that is very much because of the region's economic makeup. It has a much larger focus on manufacturing than most other parts of the country, and what we generally see is that the likes of energy use and the industrial production, now that's both coming out of the likes of Methanex and the oil and gas sector, but also from the very high level of sort of food production in the primary sector and what have you. Technically, on the accounting standards, gives you a higher carbon load, higher emissions load rather, and so suggests that over time the way to bring that down is to reevaluate how some of our industrial processes go and how to capture some of that carbon emission, but also thinking as carefully as possible around our food production and how we can make that both economically sustainable but also environmentally sustainable too. Now, we did want to have a bit more of a deep dive into some of the Māori outcomes, and a lot of the data sets, in fact, that we have access to don't have quite as many dimensions as we might like. So we did also look at some supplementary data that Statistics New Zealand has pulled forward. It is more of a survey base, and it's only at a regional level rather than breaking it down, but again gives us just some key trends that I want to go through briefly. I know we're sort of and then we'll get to questions very shortly after that. The first one is that, and again, not surprisingly given the official numbers that we saw, but this survey also reported that there was a lower proportion of Māori that owned their own home, which reinforces the trends we saw earlier. Also, though, a high level of dampened Māori housing for Māori in Taranaki than the regional average and the national average. and as well as that, compounding those issues around the likes of connectivity that we saw particularly for South Taranaki, also a lower level of internet access for Māori in Taranaki. Interestingly though, and I guess importantly, we see a high level of cell phone access for Māori, which I guess is important as we also redefine exactly how people do connect. People, yes, it's very important to have your broadband at home, but increasingly people are more mobile, and certainly for communities that might well be more mobile in these areas that don't have the same sort of housing outcomes, that access to a cell phone is important. I guess just as important that they have the money to put on it to have access to data and calling minutes and texts and similar to engage with government departments, with employers and with family and similar. A high level of discrimination was reported by Taranaki Māori than Māori across the country, again concerning when there are those effectively social divisions that we start to see. But encouragingly, and I'll show you some figures on the other side that sort of give you pause for thought there, also a lower mental wellbeing score for Māori across Taranaki and slightly lower iwi engagement than we might have seen. Now, this is a doom and gloom side, don't get me wrong, but that's because I wanted to contrast it with some of the much better outcomes that Māori are reporting as well, just to show that this is not, just completely the world is stuffed and we're never going to recover from it sort of thing. What we did also see is, despite all of those challenges that Māori and Taranaki report, that Māori also had a much greater level of life satisfaction than Māori across the country. So very much a better starting position there. You also saw a much higher level of manaakitanga, with a lot of people wanting to go and help out across their regions. Now that's a variety of things, be it sports or cultural engagements at kapahaka and similar, or helping out at marae or in community centres. But there was a greater level of reaching out and helping out, which again suggests that Māori are very much willing to be partners and come to the table there and do things themselves in a sense, with hopefully some more support. Also a high level of sort of sustainability. Again, it's sort of getting a little bit into the cultural elements of Māoridom here, but you do see a high level both of homegrown food, so sustainability in terms of self-sustenance, but also of utilising traditional Māori foods and similar. So again, just suggesting that there is a very strong cultural wellbeing framework coming out of Māori across Taranaki. And then finally, a much greater level of, a stronger level of whānau support, both in terms of how they rate their own wellbeing within their whānau, but also the feeling that if they needed a hand, they could ask and that call would be answered. And finally, greater level of our average engagement with various Māori customary and cultural practices. So again, some of the more objective wellbeing numbers that we saw in the first slide do highlight some challenges, but Māori themselves have a very strong sort of cultural baseline that they are operating from, and a real ability, you get the feeling, to launch from there around some of these wellbeing challenges and needs. So, very finally, last three slides, promise, then we'll get to questions, and I'll take a breath and a sip of water for a second. The first one is that we saw still a number of concerning outcomes or real challenges around the need for greater support in that sort of education and training space. We know that we want to see the unemployment rate and the NEET rate and similar come down. We know that we want to see those educational outcomes continue to increase, particularly across South Taranaki, because people that do have those sort of jobs, they create their own opportunities, they can determine their lives in a much greater way. So that's both in terms of looking at those educational barriers, what's actually stopping us from getting a higher NCA rate, how do we get people to go into further education, even if it's not sort of as formalised as we might have seen it, but also looking at employment itself and going, look, if we've got a bunch of people that are unemployed already, they might not be ready to go straight back into employment or into education similar, what are those barriers around sort of more the soft skills and the likes of pastoral care that might need to be provided there to get them to not only go into a job but show up consistently and feel proud of being able to do that. The second one was really around those connections that we identified, both physical and digital connectivity being critical in this day and age. So looking at, why are there so many people locally that don't have access to the internet in the same way, shape or form? And again, what are the barriers to them moving around when they do have, when they're looking to access various services across the community? If they can't get there, is it that they're more than happy with public transport, or is it again that they might perhaps stay at home and don't access those resources as much as they might need to? And then the last one there, just for this slide, I've got a few more, is that sort of question around childcare support. If there are higher levels there, it might not be a challenge, but it again was very much a question that was thrown up in the research around why are we seeing that quite as much? What are the insights we need to gain more understanding of to figure out if there's a problem, and if there is a problem, what the solutions might well be. The health one remains a key area. Now there's a collection there, and what really does show up is it's around not only not the cost and the transport element, it's around the actual access to practitioners and to health care more generally. Now, part of that's going to be if you can try and deliver things more digitally, you might not need to have the actual body of medical staff here in the region, which is obviously already a challenge to provide. But if we've only got 80% of the community that have access to the internet and similar, you can't start to deliver those online connectivity, healthcare consults and similar. We also know as well that again, even if we can start to address some of those other issues, if people can't drive around, they might struggle sometimes to get to healthcare. And so the feeling there was trying to make sure that there are the right people in the right places to deliver those services. And that's across sort of the entire wellbeing spectrum there. It's not just sort of your physical health, it's also the mental health support as well. And I guess sort of trying to find new ways to deliver given the challenges there. Finally, the Māori outcomes, better or higher Māori outcomes needed, sort of focusing that there is a good, strong community base, that Māori sort of have that strong cultural capital that is going to be important to deploy, but also there are a number of challenges there that realistically need to be and can be delivered and supported by Māori directly, but with that sort of support coming externally to provide the resources and probably the pūtea as well to do that. And very much when we're looking at that in terms of how to empower different communities, both when we looked at some of those numbers, and you can see there in terms of the greater connectivity that Māori have in their local community and the engagement there, suggests both a real potential for entrepreneurialism, but also sort of social enterprise. So how can you sort of make something generate a return, not necessarily fully for profit, but more for profit for the community, is something that came through as sort of a clear finding there. And then lastly, just around South Taranaki in general, I put up this map just to sort of show how broad and wide the area is, not nearly as sort of narrow and defined as the likes of New Plymouth, and again just suggests that part of the challenge it does look like is that sort of just spread that the district has, and the difficulties that it might be sometimes to have that more joined up and connected, integrated approach. But I think that the major one does seem to be starting around the likes of housing as a key foundation for getting things right in South Taranaki. Again, you sort of provide those better starting foundations, people are able to springboard from there on some of the other challenges, and again with some of the connectivity that you'd hope to be established through better housing outcomes as well, you'd hope that people in South Taranaki would be better connected to the services they need so that they can improve their own lives, but also have access to greater employment opportunities and similar. Whew. Who's exhausted? I am. That was a lot, right? The final closing remarks I want to put forward there before I turn it over to questions is just to note that, look, there was a huge amount of information coming through there. Did we solve absolutely every question imaginable? Absolutely not. But did we finally come up with a more comprehensive and integrated approach to understanding the various different challenges? Yes, absolutely. This is very much not the end of the process, it is the start, but hopefully this sort of research does give you, a good framework for understanding how the different parts of wellbeing might well be integrated, so it's not just in that sort of same siloed thinking that we previously had, where someone would look at education and try and solve the education issues, and someone else would look at housing and try and solve the housing issues. It's how do we group all of those together and understand the challenges and how to move forward. But I guess as well, and this is something that Maria I'm sure will speak to, that integrated approach, it's no one person's job to fix this, but through this sort of information, through sharing the resources and the willingness to contribute, I think there are some huge potential to be delivered here. I'm going to take a breath for a second, have a drink of water, and then otherwise very happy to try and take any and all of your questions. I mean, one of the big struggles that we've got is that, and you're right, a lot of that information was from the census back in 2018, which people will also remember wasn't the greatest census we've ever run, which is another issue in itself. I guess what we try and do there is what I like to call triangulation. There's always going to be a question that someone wants to ask that we will never have a data set purely to answer, but hopefully by pulling together as much of the different sets of information together as possible, we'll have a better reading on it. So, for example, the likes of the income distribution, although we know that income has gone up in Taranaki as it has in most other parts of the country, we also know that generally speaking, looking at it, we haven't seen a huge divergence in that expected trend. So we're relatively comfortable that the distribution, for example, at the census broadly should have held true. The other one is, we look at the likes of the labour market and similar. Now we could talk NEETs, we could talk unemployment or similar. All of those in a sense are only partial indicators, and so together the feeling is, when we look at the likes of the lower income distribution, if we look at the likes of, you're right around the NEET rate, it is very volatile though. You look at the long-term trend though for the likes of the unemployment rate, you look at those educational outcomes that are sort of plateauing and similar, you look at the general income and household income, all of that builds towards the picture of still needing to be addressed. And a lot of these challenges, I think, what was interesting, and even if I tried to take you back to the benefit numbers, is that the levels might be higher now and might also be changing because of COVID. That's absolutely true, and the world is moving fast. The trends, though, are relatively well established, that you sort of saw there that there's a pretty big weight of evidence that, for example, there were greater needs in the likes of South Taranaki. Now, healthcare is another good example. When we looked at the access to GPs and the number of GP visits and ED visits and similar, we've got data there stretching back all the way, I think, to either 2014 or 2011, and the trends are very well established in those sets of data as well. So we always, because of the challenge around collecting data on a similar time period and also on a similar basis, means it's very hard to pinpoint to any one data set and say good, bad or otherwise at this exact point in time. But together, I guess, in general, we're taking that view that all of the indicators seem to be pointing in a similar sort of direction, and that's the way we tried to triangulate that sort of information. But it is a challenge, absolutely. I guess the final point I make there is that this also gives an ability to track things over time, as we start to get more information, but also as we start to bring in, I guess, information more locally from the community. People are going to have a lot of information out there that probably isn't shared because it's never been thought of in that way. As we move forward, that's the sort of thing that can supplement our thinking outside of the sort of official data exercises that government and agencies might undertake. Yeah, broad answer there is I think you would, and it comes back to that sort of siloing effect. Like normally for these sort of statistics and this sort of information, I'd have to do 7 different presentations. One would be to the health practitioners on the health stuff, another to the housing lot on the housing stuff, yada, yada, yada. And I say that because I was privileged enough back in 2015 as a university student to go to Treasury and talk a lot about poverty in New Zealand. We had the then Finance Minister, Bill English, come and talk to us, and he talked about the siloing effect that you often had. And his example was in South Auckland, you have a family that's living in a pretty ratty rental. Now, MSD looks at them and goes, oh, that's a housing thing, that's for Kāinga Ora to look at. Kāinga Ora looks at it and goes, oh, that's overcrowded and there's lots of pneumonia and that's a Ministry of Health issue to deal with, the local DHB. The local DHB looks at it and goes, oh, that's they're on benefits, they need a bit more support, that's an MSD thing. None of them take responsibility for it. And because of that, you sort of have that buck passing. Now, any central government in the room that I'm about to offend? There probably is. That's fine. I've said it a number of times. But it's not a criticism of the people, it's a criticism of the structure. If you look at housing, for example, at the moment, can anyone yell out and tell me what the lead agency on housing in New Zealand is? Because I don't know. Is it Treasury? Is it the Reserve Bank? Is it Housing and Urban Development? Is it MB who runs all the tenancy stuff? Is it Kāinga Ora itself? That's 5 already, and I could probably list a few more. It is a struggle to get that momentum going because everything has to go through all the various processes. Now, the fact that, a lot of the time central government does struggle to talk left and right hand because of that sort of high level of activity is a challenge. And I say that because the structures that are in place there are often important from a public probability sort of point of view and similar. What I think happens is that the action that needs to happen on the ground doesn't get going quite as fast because no one is able or willing to champion it. I mean, look at council, for example. Council doesn't have responsibility for health or education. That's a stay out of your, stay in your lane sort of area. And it does suggest that there's a rethink needed in how you structure it. Now, labour the point a little bit, I think one of the good examples of where you're seeing a shift in thinking is around the regional skills leadership groups. Because what it says is, okay, there's a whole lot of different agencies here that have to all work together to provide. If any one organisation doesn't contribute, the entire idea is stuffed. You can have all the employers that are keen as beans to provide, you can have TEC and the government agencies who are keen as beans to do stuff, but if the education providers aren't linked up and they don't know what courses to provide, the entire thing falls over. The same with basically everything else we provide here. And so I think the thinking here has to be, how do we get that local leadership to essentially take a bit of a punt, go forward and say, look, this is the plan, come on with us. We're not, there is a need, I think, for that think local and deliver local. You saw that a lot during COVID. Everyone was willing to give up a bit of their patch protection to actually go forward and make some big changes. Now I think is the time to do similar more broadly. Now, in a sense, I don't necessarily think that, I don't have too much of a view over who has to sit in control of that, but I think everyone sort of has to give up a little bit of their own protection of their own area and be willing to cede some of that for the betterment of all, because there is a need to get on with stuff rather than sort of have meetings and similar. Like, look, realistically after this, you should all partner up with at least one other person in this room and decide to take some action rather than just listening to me harp on for an hour. That would be the best outcome. And in fact, if I could sit up here while you guys talk for the entire time, it might well have been a bit more productive. Hopefully, though, I've given you some information to go, crikey, that's an issue. Who do I know? I have a bit of responsibility in this area, but if I actually want to get something done tangibly, I need to work with these other guys. That's the sort of connection I think that should happen after this. And yep, that will require some change in structures, but it also realistically requires a big change in thinking. Yes, it is, but no one really is ever able to prove it. And look, part of this comes down to that whole point of what gets measured gets managed. Now, there's a sort of a good reason for it. We don't want to get too invasive into people's lives to figure out just how much money they do or don't have, but we certainly do know that over time the amount of money that people are paying out for, well, you saw rents there, which sort of gives you a bit of a read in terms of disposable income, because you have to pay for housing. That's the absolute base. You'll go without food before you go without a house, generally speaking. So that gives us a bit of a clue. What we also know, though, is over time the likes of mortgage repayments and similar, but also the critical essentials have gone up. So our analysis, this is just national analysis, suggested that at the end of 2021, so before all of the further hits that the economy has seen, that the cost of essentials, so that was either rates, either rent or a mortgage, rates, fuel and food, I think it must have been, had increased between $70 and $100 a week on average. At the same time, wages had increased on average $50 a week for someone working a full 40-hour week. Now that's 50 before tax. So you can sort of see that yes, effectively the amount of disposable income has gone down, and the rise in the requirement for food parcels and similar is a very good partial indicator that people are in more dire straits and require more support in general. Yeah. So again, not the formal answer you're looking for, but through triangulation we've tried to use all the other information to suggest what that might look like. Yep, that's a very fair question. I would have to go back and look at them specifically. I feel like my general recollection through the various numbers was that most of them didn't seem to be, they seemed a lot more sticky, if you will, and hadn't moved as much. I think there are a few where I don't think, if there was a downwards trend in most areas, they certainly hadn't necessarily gone up at the same time as everyone had gone down, but they had either not moved or not moved down quite as much. That gap, in a sense, the average was bigger. That's my general feeling. I would have to go back into the specific areas. I'm very happy to if you've got some specific questions, but broadly speaking, yeah. And I guess that was the reason to highlight them sort of so consistently, both in the presentation and the report, is that quite a number of areas came up more than once in those numbers, and it wasn't only that they were necessarily high, but it was that they were sort of persistently high. Yeah. Yeah. Absolutely. And I guess just to highlight that as well, that's one of the reasons that although, especially for that lower level stuff, that's why we use the census, because it's effectively the only resource that we get at that sort of level. That is why, particularly for the likes of healthcare, and that we supplemented that with the likes of the New Zealand Health Survey, which is, it's a survey, sure, but the likes of the avoidable hospitalisations and the mental health, that's administrative data. So, anyone in that community that accessed it who, wouldn't fill out a survey sort of thing, we still capture data on them. So hopefully, again, that triangulation tries to capture it, but certainly note that point. I mean, the fact that Stats NZ forgot half of Marlborough in the last census sort of demonstrates the limitations there. Fantastic. Okay, well, I don't see any other hands desperately wanting to pop up. So I guess just the final remarks from me before I return the stage over to you, Maria, is just to note that, look, there are some big challenges here, and that, in a sense, the report and the presentation doesn't necessarily go in and highlight all of the absolutely amazing things that are happening locally, and that's because the data is what it is, and the focus there was to try and establish where the needs are so that investment and action can be taken in sort of as integrated an approach as possible. That's not to say there isn't already some incredible work going on, but it is to suggest that there's always more that needs to be done. Importantly, I think having you guys in the room is critically important. I say that coming from the ivory tower of Wellington, we've done the numbers and we've hopefully given an evidence base, but it is reassuring that being able to present to community leaders suggests that something is going to be done with it. That's the whole point of this exercise, which is quite reassuring from a consultant's point of view. But I really do sort of commend all of you being able to sort of take your time and hopefully look to integrate some of this information into your operations to collaborate a bit more and try and provide those better outcomes. Because at the end of the day, for as much data and charts and colours that I've shown you, there are real people behind this at the end of the day. They do want to do better. They deserve to be able to do better and to create those better foundations. If this evidence helps, I think is going to be a major improvement. So thank you very much.
Thanks, Brad. I think the key point is actually what Brad mentioned, that it's all very well having this research and having this document, but if it's just going to sit on a shelf and we're not going to use it and we're not going to come together and think about how we collectively, if we had a shared goal, a shared vision of what we're looking to achieve, and we all work together, we've all got something we can bring. And that's what we're really interested in at the Toi Foundation. So we're really interested in collaborating and really want to almost put out a call to action. Who wants to work with us on what some of these issues are? There'll be things in this report that won't be a surprise to you. You'll have had a feeling about them anyway, but it's giving us a starting point, something that we can start to address and something we can start to look at. So for those that are here, and we've got another session this afternoon, we'd definitely like to say if you want to work with us on some of these issues, we're really interested. That's what we're here for. We're not just about filling out an application and sending it in to us and hoping that you get some funds. We're actually here about wanting to make some substantial changes for our people in Taranaki, because we're really passionate about this beautiful place that we live in. So, kia ora.